My name is David Clark. I'm the Professor of Psychology at King's College London. If I was a patient and I was suffering from one of the common mental health problems such as depression or one of the anxiety disorders, my GP might suggest that I could benefit from a course of psychological therapy, particularly cognitive behaviour therapy. Cognitive behaviour therapy is a short-term psychological therapy, usually involves seeing a therapist once a week for between 5 and 20 sessions. Also, you're set a number of assignments to do between the therapy sessions, which we often call homework. The treatment is called cognitive behaviour therapy because it focuses on your thinking patterns or cognitions and also on your behaviour. Scientific research has shown that cognitive behaviour therapy is effective for a wide range of mental health problems, depression, all the different anxiety disorders such as social anxiety, panic disorder, post-traumatic stress, health anxiety. It also helps eating disorders such as bulimia nervosa, and also people who find themselves having physical problems which have some sort of psychological basis as well. Well, CBT starts off by breaking down your problem into smaller components, often trying to identify particular problematic thoughts and behaviours, and then once it's been broken down in that way, it often suggests a fairly straightforward way in which you and your therapist can intervene to promote recovery and also hopefully to learn some new techniques which would mean you're less likely to experience that problem again in the future. But I've had dreams. Well, there are two main techniques that are used in CBT. The first is discussions with your therapist of the sort of evidence for and against negative beliefs. And then the second is what we call behavioural experiments. They're ways in which you test your beliefs by changing your behaviour and seeing what happens. CBT has a lot of characteristics which are similar to other talking therapies. First, you see someone who's very interested in your problem, who's warm and empathic and takes a great interest in your difficulties and breaks them down into components. But the additional point about cognitive behaviour therapy is it's highly structured. It tends to focus on the here and now and practical ways of solving your problems, rather than spending a lot of time delving into the past, although at times some of that can be helpful. Cognitive behaviour therapy isn't a panacea. It doesn't work for absolutely everyone. And in those people that it is helpful, there's a range of sort of responses you can get. There's a significant group of people who have a complete recovery. The problem they came in for therapy has completely gone away. There are other people who achieve very worthwhile benefit and allows them to get back to work and to do many things that the condition was preventing them from doing, but they still have some residual symptoms. What we know from the research is that it tends to reduce your risk of further problems if things go wrong in your life. So, for example, depression is a recurring problem, and people who have one episode have quite an increased chance of having further episodes later in their life. But cognitive therapy seems to reduce the chance of that happening without completely abolishing it.